Hello everyone, and thanks for joining me today. I'm Dr. Nancy, and today I'm going to be chatting to you about low back pain. Low back pain is very common. It's got a prevalence of 60%, which means in a lifetime there's a 60% chance that someone will have it or has already had it. So I'm going to have a chat about that. So there are many things that can cause low back pain. Some of them can be quite dangerous, and you need to go see a specialist or at least a first point healthcare professional. So please make sure that if you've had some issues that you check them out first. But if you're just having a little bit of an ache or pain, for example after doing some gardening or things like that, then this is what this video is aimed to do, just to show you where you could do some stretches for some tight muscles or some joints that have just had a little bit of a workout. So keep in mind that when you do some muscle stretches and exercises, you might be a little bit tender or sore. So this is basically our lovely spine here. So these little gaps here, they're called facet joints. So they're the gap between the bone up here and the bone down here. Bone up here, bone down here. So little space. So that space is full of fluid, and that fluid is called synovial fluid. This fluid, if it's healthy, it just allows the joints to move and slide together. If it's inflamed, then you'll feel some pain, discomfort. It can make the muscle around it agitated, and so we'll need to have a look. So basically I get my patients very commonly coming in saying they have pain in this area here. So this pain area commonly corresponds to a muscle called the QL, or quadratus lumborum. So the QL is a muscle that starts from here, last rib, to the top of the hip. Okay, it's this red structure. So when this muscle is tight, it can cause some pain in the area, referring down a little bit or referring up a little bit, but typically most of the pain is quite centered there. So when I get my patients to do this stretch, I call it the ballerina stretch. So what you're trying to do is imagine the muscles right there, okay? So I get my patients to lean their arm forward and over. And what they're trying to do is arch the back like a cat, okay? And you're trying to feel that stretch in that area. If you can't quite feel it in that area, you might need to twist a little bit that way or that way, okay, until you can feel it in that area. But what you're trying to do is really aiming 45-degree angle over, so you're not purely to the side. If you do it purely to the side, you'll feel it more here. If you go a little bit more forward, you'll feel it more at the back, okay? So when you do that stretch, you need to hold it for at least 30 seconds. I always suggest do both sides, because if you do both sides, you'll get an understanding of which side is tighter, which side you need to do a bit more work on. I mean, it might be the more painful side, but you might figure out that this side that's not painful is also tight and does need a stretch. So what I always give my patients to do at home as well is a ball exercise. So the ball that I like to use, kind of size of a tennis ball. If you've got a tennis ball lying around, anything around this size is perfect. I've had patients try golf balls. They're probably a little bit small and hard, but whatever you've got around. So what you're doing is you're holding the ball up against that muscle, okay, and you're leaning into the wall, okay. You're leaning into the wall for about 3 to 5 seconds, enough to just feel that nice, almost I call it good pain, and you're just feeling that nice tender sort of good pain for a few seconds. Don't push too hard, because you can get some interesting bruises with using anything that's pokey, and also keep in mind that if you do too hard, just give yourself a couple of days break, because I've had patients who are just going crazy stretching. I mean, if you can imagine, you're not going to go see a massage therapist every day for a week, so you know, you just do it a couple of times a day, see how you go the next day. If you're still alright, keep doing them, but really just a little bit of a bit of common sense, so you don't hurt yourself. Okay, so the next stretch that I love for low back, I mean, I'll show you on my spine why this one is so important. So if you've got low back pain, if your hips are getting pulled by tug of war from your leg muscles rather, so if you've got your hamstrings that are pulling too far at the back, or your quads that are pulling too tight at the front, what's going to happen is your poor low back is going to get a bit more pressure on it than it's already experiencing. So what we want to do is, if this area is getting so much pressure, we want to alleviate any pressure coming from the leg muscles. So the leg muscles, the quads are the muscles at the front, the hamstrings are the muscles at the back. There's plenty of posters and Google and gym posters as to how to stretch hamstrings and quads. So please take the time to do that, especially if you go to the gym and you work on your legs often. If you're taking the time to work on your legs, you really should take the time to do the stretches afterwards, please, because the quads and the hamstrings are big muscles, and what you're trying to do is make sure that these big muscles, I mean, you can foam roller them. I've dried needle my patients before, and some of this stuff is just so not effective if people aren't doing stretches and looking after their muscles properly. What I think is really important too with leg muscles in particular, because they are big muscles, is taking a magnesium supplement. So magnesium very commonly has been shown in research to allow muscles to relax, and also can give you a good night's sleep. So if you do have tight hamstrings and quads, or just muscles that are tight in general, please have a go at a magnesium supplement. I prefer the powder form because it's been shown in some research to be absorbed a bit better. I do have a preference for some brands. I personally like Metagenics and Bioceuticals because they have been shown to be able to be absorbed a little bit better. But you can, I mean, I've tried other brands that you can get from the pharmacy. I've tried Bioglan, which I found actually pretty good even in tablet form. So you might need to try a few different ones before you find one that works. Some of them are practitioner only ones, so you may have to see somebody to be able to access those supplements. But I think a magnesium supplement is amazing for legs, tight legs, which can affect your low back. But even if you took a magnesium supplement, it will relax your low back muscles anyway. But what I'm saying is big muscles need good stretches, and as I've mentioned, sometimes it's like flogging a dead horse, pardon the phrase, but if you're not working on your big muscles to relax them, it's kind of, you're going back and forth. So the last muscle stretch that I'm going to show you or talk about is the glute stretch. So again, if you can imagine, you've got your low back pain coming from here. If the glute muscles are tensing, they can pull the hip joint in a funny way and cause more pain. So the glute muscles, so typically the piriformis is a triangular muscle, starts from here and goes to here. Okay, so it sort of sits triangularly like so. So if this muscle's tense, it can affect this area here, it can also affect there. So I find commonly that's one of the other ones that's tight in low back pain. So when we're stretching it, I love doing this stretch because it's so easy to do it seated. I do it at my office chair all the time. So what I'm doing is I'm sitting down, my leg goes on top of my other leg, I'm just sitting cross-legged, and I'm just sitting up straight. If we sit upright, you'll feel a bit of pain right in the bottom of the glute. Sometimes you might feel it a bit at the front of the hip as well. It just feels like a nice gentle stretch. You can lean forward a little bit. You can sit upright to get it where you need to feel it, and hold it for about 30 seconds and do the other side again, just to give yourself an impression as to which side might be tighter, and how you can balance them out a little bit. So I hope this has been useful for you. Keep in mind, I've only discussed muscles and joints. There are other causes of low back pain, things like discs, and other more dangerous things that warrant a referral to a specialist. So please go do see someone if it's not just an ache, and if it's getting worse, and if there's any pain that's increasing, becoming more severe, pins and needles, numbness, tingling, bowel bladder symptoms, anything like that, then you need to get it checked as soon as possible. Thank you so much for tuning in, and stay in good health until I see you next time.